Lifts and vehicle transfers. Welcome to our module on lift and vehicle transfers, where we will discuss determining when to use a lift and which style is best, safety considerations when using lifts, determining when a vehicle transfer is safe, how to safely perform a vehicle transfer. Let's start by reviewing the definitions of some words we'll use today. Transfer. To assist a patient from one place to another, often from one chair to another, from a bed to a chair, or from a chair to a bed. Physical therapist, PT. A healthcare professional who specializes in safe patient movement. Mechanical lift, a device used to lift and transfer a patient who cannot put any weight on or move their legs. Hoyer, a brand of mechanical lift. Sit-to-stand lift, a device used to lift and transfer a patient who can put some weight on and move their legs but cannot safely stand. Bear weight, the ability to support one's own weight with legs and feet. Sling, a flexible attachment that wraps around a patient and hooks to a mechanical or sit-to-stand lift to hold the patient during transfer. When caring for your patient, you'll need to help them move from place to place. Whether from the bed to a chair or back again, you must make sure that both you and the patient remain safe during the transfer. How do you know if you need to use a lift during a transfer? First, check the patient's care plan. The healthcare team, including the physical therapist, may have already evaluated the patient and determined that they need a lift for transfers. If your patient has not needed a lift previously but can no longer bear weight or stand, report the change to the healthcare team immediately. Ask for assistance in deciding if a lift would be best and what kind is most appropriate. Remember that transferring a patient who cannot stand is unsafe for both you and the patient. For more information on performing transfers without a lift, see our module on transfers. Sit-to-stand lifts are used for patients who can assist as you stand them, but cannot bear enough weight to stand completely or remain standing. These patients can also move their legs and feet when instructed to. These lifts use a sling that attaches to the device's arms. The sling supports the patient's back as the lift assists the patient to a standing position. This type of lift does not fully support the patient, so it must be used with a patient who can bear weight on their legs and feet. Mechanical lifts, sometimes called Hoyer lifts, are used for patients who cannot bear any weight on their legs and feet, or cannot move their legs when instructed to do so. These lifts also involve using a sling that attaches to the device's arms. The sling fully supports the patient's body as the lift picks them up, holds them, and then gently lowers them to a sitting or lying position. Always make sure the sling fully supports your patient's head and neck as you move them. Having a second person to assist you as you transfer your patient using this lift is best. When using any lift, always make sure that you understand how to use it properly. Follow all manufacturers' directions carefully. Some helpful tips for using a lift are: always place the sling behind the patient with the tag at the top and away from the patient. If the sling's attachment loops are color-coded, refer to the patient's healthcare team for the most appropriate one to use. Some lifts have attachment buttons placed along the arms. Be sure to ask the patient's healthcare team which one is most appropriate to use. When lifting a patient using a sit-to-stand lift, have them hold the lift arms for stability. When lifting a patient using a mechanical lift, have the patient hug themselves so their arms remain safely out of the way of the lift. When transferring a patient to or from a wheelchair, bring the wheelchair as close to the second destination as possible, limiting the distance that you'll need to drive the lift. Always make sure that the floor is clear of obstructions before you assist the patient into the lift sling. Always stay with your patient while they're in the sling. Never pull the sling out from under your patient. This can cause skin damage. Instead, roll your patient from side to side to remove the sling. If your patient needs to leave the home, you'll need to determine if assisting your patient into and out of the vehicle is safe. First, discuss this with the healthcare team. The physical therapy may make recommendations regarding whether or not this is a safe option for the patient. Also, it's important to know the type of vehicle available. A truck that's very high or a very low car may not be appropriate for transporting the patient. Patients who cannot safely transfer to a vehicle may need to be driven to their destination in a specialized van. If the healthcare team determines that your patient is safe to transfer to the vehicle, follow these steps to do so safely. Make sure your patient understands the transfer plan. If your patient uses a walker, wheelchair, or cane, make sure they use it during the transfer. Load the vehicle with any items you'll take along on the trip. Make sure the patient has used the toilet before beginning. For more information on assisting your patient to do so, see our modules on toileting and bowel and bladder incontinence care. Bring the vehicle to a location as close to the home's exit as possible. Open the vehicle door. Assist the patient to the vehicle using the method they typically use for walking. For more information on how to safely assist your patient to walk, see our module on ambulation. If your patient uses a wheelchair, push the wheelchair to the car door and lock the wheels. For patients using a cane or walker, assist them in standing against the vehicle with the back of their legs touching the car seat. Encourage them to reach behind and place their hands on the car seat as they sit. The patient should not hold on to the car door. Support your patient as they slowly sit in the seat. For patients using a wheelchair, assist them to stand, then provide support as they shuffle slowly around until the back of their legs are against the car seat. Encourage them to reach behind for the seat and support them to sit slowly. Assist your patient to lift and move their legs into the car. Once your patient is comfortable, assist them to place their seatbelt on and close the door. When arriving at the destination, repeat the steps in reverse to transfer your patient out of the vehicle safely. Thank you for attending our module on lift and vehicle transfers. We hope you've gained a better understanding of how to safely transfer your patient using a lift and how to perform a vehicle transfer safely.